grade 9 students. How are you doing? I hope everything is fine. We are now in the second week of our modular learning in this time of pandemic. I am Teacher Rose and I'll be the one to help you understand the topic for this module.
In the second module, you will learn how to infer one's lifestyle that may affect the functioning of the respiratory and circulatory system. Science 9 Module 2. Lifestyles that affect the functioning of respiratory and circulatory system.
At this juncture, we are going to point out the necessary skills required for this module.
What I need to know. First, we are going to explain how the respiratory and circulatory systems working together to transport nutrients, gases, and other molecules to and from the different parts of the body. Second, identify the different diseases in respiratory and circulatory system. Third, describe blood flow and gas exchange within the heart, circulatory system, and lungs. Fourth, infer how one's lifestyle can affect the functioning of the respiratory and circulatory system. Next, identify ways of detecting and preventing diseases in the respiratory and circulatory systems. Last but not the least, appreciate the importance of a healthy lifestyle in avoiding such diseases.
Moving on, we are going to check your prior knowledge by answering the 15 multiple item test. Make sure that you follow the instructions. Get ready, prepare your pen and paper.
Multiple choice test. Copy the letters that correspond to the word or phrase that best answers the question or complete the sentence. Number 1. What do you call the process of moving oxygen-rich air into and out of the lungs? Is it A. Respiration, B. Breathing, C. Gas exchange, D. Circulation? Number 2. It is a double-walled sac that encloses the heart, which serves to protect the heart and anchor it inside the chest. A. Pericardium, B. Myocardium, C. Epicardium, D. Endocardium. Number 3. What is the average heartbeat of a newborn baby? A. 70 to 190 beats per minute, B. 60 to 80 beats per minute, C. 90 to 120 beats per minute, D. 150 to 180 beats per minute. Number 4. Where is the exact location of the heart? Is it A. The heart is located at the center of the chest, usually pointing slightly left, B. The heart is located at the center of the chest, usually pointing slightly right, C. The heart is located at the center of the chest, usually pointing left, D. The heart is located at the center of the chest, usually pointing right. Number 5. Which of the following prevent backflow, keeping the blood flowing in one direction through the heart? A. Ventricle, B. Valves, C. Atria, D. Chamber. Number 6. A chronic respiratory condition that causes difficulty breathing due to inflammation of the airways. A. Asthma, B. Emphysema, C. Lung cancer, D. Pneumonia. 7. It is a common lung disease caused by infection in the air sacs of the lungs. The infection can be bacterial, viral, or fungal. A. Emphysema, B. Asthma, C. Lung cancer, D. Pneumonia. Number 8. What do you call a condition in which patients develop abnormally dilated bronchial tubes that allows mucus to pool, causing frequent respiratory tract infections, wheezing, and shortness of breath? A. Bronchiectasis, B. Chronic bronchitis, C. Cystic fibrosis, D. Emphysema. 9. Which of the following is the effect of smoking in the respiratory system? A. Increased risk of stroke and heart attack due to the blockage of the blood supply. B. Increased risk of lung infection and symptoms such as coughing and wheezing. C. Increased risk of cancer of the cervix. D. Increased risk of painful ulcers along the digestive tract. Number 10. What are the two most common respiratory diseases caused by smoking? A. Lung cancer and COPD, B. Heart attack and pleural effusion, C. Hypertension and cystic fibrosis, D. Lung cancer and leukemia. 11. Which of the following describes the long-term effects of smoking? A. Osteoporosis and hip fracture. B. High risk of blindness. C. Tightening of certain muscle. D. Increased risk attention deficit hyperactivity disorder. 12. How many liters of blood does the heart pumps all throughout the body? A. 10.7 liters. B. 6.7 liters. C. 8.7 liters. D. 5.7 liters. 13. What is the best way to prevent diseases in the respiratory and circulatory system? A. Negative lifestyle like drinking alcohol, smoking. B. Healthy lifestyle like balanced diet, regular exercise, adequate rest. C. Clean surrounding and healthy food like pizza. D. Drinking alcoholic beverages. 14. What do you call the swelling and rupturing of the lungs air sacs that reduces the lungs' capacity to take in oxygen and expel carbon dioxide? A. Emphysema. B. Asthma. C. Pneumonia. D. Lung cancer. Last, number 15. Tobacco smoke contains carbon monoxide. What problem does this cause? A. The carbon monoxide irritates the airways, causing bronchitis. B. The carbon monoxide combines with hemoglobin in the red cells, reducing the ability of the blood to carry oxygen. C. The carbon monoxide causes lung cancer and COPD. D. The carbon monoxide blocked any arteries, causing heart attack.
Now you're done answering. To know if your answers are correct, continue listening in our discussions. This time, we will continue to explore your learning outcomes by answering what's in.
Several lifestyle choices can affect a person's risk for developing respiratory and circulatory disease. Negative lifestyle weakens your system, while healthy lifestyle leads to complete wellness. Vices, stressful environment, and unhealthy eating habits can cause various diseases, specifically of the respiratory and circulatory systems. The following activity that you will perform is a variation of a famous application game known as 4 Picks 1 Word. Use your analytical thinking in answering each set of puzzles. And after, answer the guide questions.
At this point, you are going to sharpen your minds by answering what's new.
Knowledge enhancers. Number 1. It's guessing time. You cannot see nor taste it. Yes, it is as real as land and water. When it blows, you can feel it against your face. You can also see its effects in drifting clouds, quivering leaves, and pounding waves. It can turn windmills and blow sailboats across the sea. What is it? Number 2. Perform the activity with the help of your sibling or eldest member of the family. Place a metric tape measure around your chest and directly below your armpits. Inhale. Note the size of your chest while inhaling. Record this number. Then exhale and note the size of your chest again. Record this number. How do the sizes compare? What is responsible for the difference in size?
In today's lesson, let's watch these videos.
What's up, dudes, and what's up, ladies? And in this video, we are going to look at the respiratory system. We're going to look at the functions of the respiratory system, its components, how the system works, and some things you can do to maintain a healthy respiratory system. So, let's roll. The respiratory system's main functions include transporting air into and out of the lungs, protecting the body against harmful particles that are inhaled, and its most important function, the exchange of oxygen and carbon dioxide. So it's basically about breathing. Now let's take a look at a diagram and we'll go through the respiratory system's main components. Starting here with the nose and nasal cavity, the mouth or oral cavity. The pharynx is here, and it is what we consider the throat. The pharynx is considered part of the digestive system as well as the respiratory system, and it connects the respiratory openings to the larynx and esophagus. The esophagus is not part of the respiratory system, and I'll get to why I put it in the diagram in a minute. Next we have the larynx, which is also called the voice box because the vocal cords are located here. The trachea, also called the windpipe, is here, and it connects to the bronchi, which merge into smaller tubes called bronchioles. And the bronchioles connect to tiny air sacs called alveoli. And then down here is the diaphragm. Now let's go through a very basic look at what happens during the breathing process. So air is breathed in through the nose or mouth. When it enters through the nose, it gets spread out by these shelf-like things here called conchae. The conchae help humidify the air and trap some inhaled particles. They also warm the air. The air next passes through the pharynx and enters the trachea. One note here. This little flap-like structure is called the epiglottis, and it has an important function. During breathing, it is pointed upward, allowing airflow into the trachea. However, during swallowing, it folds down to prevent food from going into the trachea, directing the food into the esophagus. If food does enter the trachea, the gag reflex is induced to protect the respiratory system. The epiglottis here, this little thing, shows you how amazing the human body is. Anyways, back to airflow. So air continues down the trachea and enters the bronchi. From there it enters into smaller bronchioles and finally into the alveoli, which are surrounded by a network of capillaries. And this, folks, is where the magic happens. Oxygen enters the alveolar sac and the gas exchange occurs. Capillaries give up their waste carbon dioxide and pick up oxygen. Carbon dioxide is then exhaled through the air passage the oxygen was inhaled through, and the oxygen picked up by the blood returns to the heart. During this breathing process, the diaphragm is busy as well, contracting as we breathe in, which allow the lungs to expand, and relaxing as we exhale. Some minor respiratory disorders include the common cold, influenza, acute bronchitis, which is inflammation of the bronchi, and pneumonia, which is inflammation of the bronchioles and alveoli. Some of the more damaging disorders include chronic bronchitis, where the bronchi become inflamed and narrowed, mainly caused by tobacco smoke, emphysema, where the alveoli become overstretched, and lung cancer, which in almost 9 out of 10 cases is caused by tobacco smoke. What can you do to maintain or improve respiratory system health? Maintain a healthy weight. Excess weight compresses respiratory muscles and puts more stress on your lungs. Drink plenty of water. Dehydration can cause the mucus lining your airways to thicken and become sticky, making you more susceptible to illness. Consume foods rich in vitamins, minerals, and antioxidants, such as fruits, veggies, and nuts, which can help reduce inflammation and fight oxidative damage. Limit exposure to common allergens, such as dust mites, pollen, and animal dander. Maintain good hygiene. Many respiratory viruses are transmitted because of bad hygiene and poor hand washing. Don't overconsume alcohol. It dehydrates the body and weakens the immune system. Get more active. Regular aerobic activity can help your respiratory system. Add indoor plants. Plants have been shown to help improve air quality. Bottom line time. As you can see, the respiratory system has a major impact on overall health. As you may already know, breathing is kind of important. So eat a healthy diet, maintain an active lifestyle, and keep up good hygiene. Remember, folks, be happy and be healthy.
You can feel your heart thudding away every time you put your hand to your chest. But do you have any idea what's really going on in there, or what keeps your heart ticking as it should? Every day, your heart beats about 100,000 times, sending 2,000 gallons of blood surging through your body. Although it's no bigger than your fist, your heart has the mighty job of keeping the blood flowing through 60,000 miles of blood vessels that feed your organs and tissues. Food, water and oxygen are essential for the existence of human life. Blood transports all these substances through various channels called blood vessels. Blood vessels involves arteries, veins, capillaries. To keep the blood flowing throughout our body, we have a pumping system, and the heart is the pump, which is composed of muscle that pumps blood throughout the body, beating approximately 72 times per minute of our lives. The human heart has 4 chambers. The right atrium, the left atrium, the right ventricle, and the left ventricle. There are 4 valves in the heart. These valves are tricuspid valve, mitral valve, aortic valve, pulmonic valve. These valves are one-way valves. Now, you have seen the structure of the heart. Let us find out how it works. The blood becomes oxygen-rich by absorbing oxygen in the lungs. The function of the heart starts when oxygenated blood is carried from the lungs to the left atrium of the heart by means of the pulmonary veins. The left atrium relaxes, this blood is pumped into the heart. When the left atrium contracts, the left ventricle relaxes simultaneously. The left atrium pushes the blood into the left ventricle through the one-way valve. When the left ventricle contracts, the blood is pumped into the aorta, which carries oxygenated blood to the different parts of the body, except the lungs. Oxygenated blood reaches the different parts of the body through the blood vessels called the arteries. The arteries gets branched into capillaries, which then reaches to the different organs of the body. The blood then becomes deoxygenated, and the blood capillaries gets mixed and form thicker blood vessels called the veins. The veins carry deoxygenated blood to the heart. The blood vessels that carry deoxygenated blood to heart are known as the vena cava. The deoxygenated blood from different parts of body enters the upper right chamber of the heart, which is called the right atrium. The right atrium gets contracted, allowing the blood to flow into the right ventricle, which contracts with the expansion of the right atrium through the one-way valve. The right ventricle then contracts, pushing the blood into the pulmonary artery. The pulmonary artery carries the deoxygenated blood to the lungs for oxygenation. The lungs oxygenate the blood by exchanging of gases and flows back into the heart through the pulmonary vein, and starts the circulatory cycle all over again.
Every time you smoke a cigarette, toxic gases pass into your lungs, then into your bloodstream, where they spread to every organ in your body. A cigarette is made using the tobacco leaf, which contains nicotine and a variety of other compounds. As the tobacco and compounds burn, they release thousands of dangerous chemicals, including over 40 known to cause cancer. Cigarette smoke contains the poisonous gases carbon monoxide and nitrogen oxide, as well as trace amounts of cancer-causing radioactive particles. All forms of tobacco are dangerous, including cigars, pipes, and smokeless tobacco such as chewing tobacco and snuff. Nicotine is an addictive chemical in tobacco. After you inhale tobacco smoke, nicotine flows through the bloodstream to your brain, where it induces a pleasurable feeling. When you repeatedly expose your brain to nicotine, it becomes desensitized, making you crave more and more nicotine just to feel normal. Smoking causes death. People who smoke typically die at an earlier age than non-smokers. In fact, 1 of every 5 deaths in the United States is linked to cigarette smoking. If you smoke, your risk of major health problems increases dramatically, including heart disease, heart attack, stroke, lung cancer, and death from chronic obstructive pulmonary disease. Smoking causes cardiovascular disease. When nicotine flows through your adrenal glands, it stimulates the release of epinephrine, a hormone that raises your blood pressure. In addition, nicotine and carbon monoxide can damage the lining of the inner walls in your arteries. Fatty deposits, called plaque, can build up at these injury sites and become large enough to narrow the arteries and severely reduce blood flow, resulting in a condition called atherosclerosis. In coronary artery disease, atherosclerosis narrows the arteries that supply the heart, which reduces the supply of oxygen to your heart muscle, increasing your risk for a heart attack. Smoking also raises your risk for blood clots because it causes platelets in your blood to clump together. Smoking increases your risk for peripheral vascular disease, in which atherosclerotic plaques block the large arteries in your arms and legs. Smoking can also cause an abdominal aortic aneurysm, which is a swelling or weakening of your aorta where it runs through your abdomen. Smoking damages two main parts of your lungs: your airways, also called bronchial tubes, and small air sacs called alveoli. With each breath, air travels down your windpipe, called the trachea, and enters your lungs through your bronchial tubes. Air then moves into thousands of tiny alveoli, where oxygen from the air moves into your bloodstream, and the waste product carbon dioxide moves out of your bloodstream. Tiny hair-like projections, called cilia, line your bronchial tubes and sweep harmful substances out of your lungs. Cigarette smoke irritates the lining of your bronchial tubes, causing them to swell and make mucus. Cigarette smoke also slows the movement of your cilia, causing some of the smoke and mucus to stay in your lungs. While you are sleeping, some of the cilia recover and start pushing more pollutants and mucus out of your lungs. When you wake up, your body attempts to expel this material by coughing repeatedly, a condition known as smoker's cough. Over time, chronic bronchitis develops as your cilia stop working, your airways become clogged with scars and mucus, and breathing becomes difficult. Your lungs are now more vulnerable to further disease. Cigarette smoke also damages your alveoli, making it harder for oxygen and carbon dioxide to exchange with your blood. Over time, so little oxygen can reach your blood that you may develop emphysema, a condition in which you must gasp for every breath and wear an oxygen tube under your nose in order to breathe. Chronic bronchitis and emphysema are collectively called chronic obstructive pulmonary disease, or COPD. COPD is a gradual loss of the ability to breathe for which there is no cure. Cigarette smoke contains at least 40 cancer-causing substances called carcinogens, including cyanide, formaldehyde, benzene, and ammonia. In your body, healthy cells grow, make new cells, then die. Genetic material inside each cell, called DNA, directs this process. If you smoke, toxic chemicals can damage the DNA in your healthy cells. As a result, your damaged cells create new unhealthy cells, which grow out of control and may spread to other parts of your body. The most common cancer in the world is lung cancer, with over 1 million new cases diagnosed every year. Harmful chemicals in cigarettes can cause cancer in other parts of your body, such as in the blood and bone marrow, mouth, larynx, throat, esophagus, stomach, pancreas, kidney, bladder, uterus, and cervix. Smoking can cause infertility in both men and women. If a woman is pregnant and smokes during pregnancy, she exposes her baby to the cigarette's poisonous chemicals, causing a greater risk of low birth weight, miscarriage, preterm delivery, stillbirth, infant death, and sudden infant death syndrome. Smoking is also dangerous if a mother is breastfeeding. Nicotine passes to the baby through breast milk and can cause restlessness, rapid heartbeat, vomiting, interrupted sleep, or diarrhea. Other health effects of smoking include low bone density and increased risk for hip fracture among women, gum disease, often leading to tooth loss and surgery, immune system dysfunction and delayed wound healing, and sexual impotence in men.
Effects of tobacco on the respiratory system. Irritation of the trachea or windpipe and larynx or voice banks. Reduced lung function and breathlessness due to swelling and narrowing of the lung airways and excess mucus in the lung passages. Impairment of the lungs clearance system, leading to the buildup of poisonous substances, which results in lung irritation and damage. Increased risk of lung infection and symptoms such as coughing and wheezing. Permanent damage to the air sacs of the lungs. Effects of tobacco on the circulatory system. Raised blood pressure and heart rate. Constriction or tightening of blood vessels in the skin, resulting in a drop in skin temperature. Less oxygen carried by the blood during exercise. Stickier blood, which is more prone to clotting. Damage to the lining of the arteries, which is thought to be a contributing factor to atherosclerosis, or deposits on the artery walls. Reduced blood flow to extremities. Increased risk of stroke and heart attack due to the blockage of blood supply. Top 8 respiratory illnesses and diseases. Respiratory illnesses is a common problem in the United States. Many times, people are genetically more likely to get respiratory conditions, but your workplace or environmental exposures could also play a big role. One thing is for sure, smoking is the most common cause of respiratory disease. Unity Point Health pulmonologist in the name of Jim Lear, DO, tells us that top 8 respiratory system illnesses. So we have here asthma, chronic obstructive pulmonary disease or COPD, chronic bronchitis, emphysema, pleural effusion, lung cancer, cystic fibrosis, pneumonia, and additional COVID-19. Asthma is defined as a common chronic respiratory condition that causes difficulty breathing due to inflammation of the airways. Symptoms include dry cough, wheezing, chest tightness, and shortness of breath. Dr. Mayer says, there is a major connection between environmental allergies and asthma. Allergic reactions, infections, and pollution can also trigger an asthma attack. Those with persistent asthma often notice a better quality of life with the help of anti-inflammatory medication. According to Dr. Mayer, everyone who has asthma needs to have a rescue inhaler to open airways quickly. Usually, asthma starts in childhood years and progresses into adulthood. However, some people in their 60s, 70s, and 80s can get onset asthma. Dr. Mayer says asthma is a reversible obstructive lung disease. He's seen asthma patients who are respiratory disease known as COPD. COPD is an umbrella term that encompasses several respiratory illnesses that causes breathlessness or the inability to exhale normally. People usually experience symptoms including shortness of breath and normally cough up sputum, especially in the morning. This disease is generally associated with cigarette smoking. It's rare to see people with COPD who haven't been exposed to some sort of smoking. People can experience varying severity levels of COPD. At its most severe, it can cause people difficulty doing everyday activities. Dr. Mayer says, chronic bronchitis is a form of COPD emphasized by a chronic cough. Usually, people cough up sputum, especially in the morning. Dr. Mayer says this happens because mucous glands in the airways increase output and patients have to cough extra secretion out. Emphysema is a serious respiratory disease, which is another form of COPD. The most common cause is smoking. Those who suffer from emphysema have trouble exhaling air from their lungs. Cigarette smoke damages the air sacs in the lungs to a point where they can no longer repair themselves. Dr. Mayer says this respiratory illness most commonly leads to respiratory failure and the need for extra oxygen to breathing needs. Evolves slowly over the years and there is no cure. However, those who quit smoking are most likely to see the disease's progression slow. Lung cancer. With the ability to develop in any part of the lungs, this cancer is difficult to detect. Most often, the cancer develops in the main part of the lungs near the air sac. DNA mutation in the lungs can cause irregular cells to multiply and create an uncontrolled growth of abnormal cells or a tumor. These tumors interfere with the regular functions of the lungs. Cystic fibrosis or bronchiectasis is a genetic respiratory disease caused by defective gene that creates thick and sticky mucus that clogs up tubes and passageways. This mucus causes repeat and dangerous lung infections as well as obstruction in the pancreas that prevent important enzymes from breaking down nutrients for the body. Bronchiectasis is a condition in which patients develop abnormally dilated bronchial tubes. This allows mucus to pool, causing frequent respiratory tract infections, wheezing, and shortness of breath. Usually develops later in life and is more common in women than men. Pneumonia is common lung disease caused by infection in the air sacs in the lungs. The infections can be bacterial, viral, or fungal. Most people can recover in 1 to 3 weeks, but for certain people, pneumonia can be extremely serious and even life-threatening.
Pneumonia is inflammation in your lungs caused by an infection. You have 2 lungs, one on each side of your chest. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon, and when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. If you have pneumonia, your airways or lungs have an infection caused by germs, such as bacteria, viruses, fungi, or parasites. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. Hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you may expel them by coughing. Sometimes germs make it past your mucus and cilia and enter your alveoli. Normally, cells of your immune system attack these germs, which keep them from making you sick. However, if your immune system is weakened due to age, illness, or fatigue, pneumonia-causing germs can overwhelm your immune cells and begin to multiply. Your bronchioles and alveoli become inflamed as your immune system attacks the multiplying germs. The inflammation causes your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. If you have lobar pneumonia, one lobe of your lungs is affected. If you have bronchopneumonia, many areas of both lungs are affected. Pneumonia may cause the following symptoms: difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. Pneumonia can lead to serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. Bacteremia occurs when the bacteria causing your pneumonia move into your bloodstream, where they may travel to infect other organs. In some cases of pneumonia, a large collection of fluid and pus, called an abscess, may form inside one of your lungs. If an abscess forms around the outside of your lung, it's called an empyema. Possible treatments for pneumonia include antibiotics, if the cause is bacteria or a parasite, antiviral drugs, if the cause is a flu virus, antifungal medication, if the cause is a fungus, rest and drinking plenty of fluids, and over-the-counter or OTC remedies to manage your fever, aches, and pains. If you have severe pneumonia, you may be admitted to the hospital and given intravenous antibiotics and oxygen.
Pleural effusion is a collection of fluid between the lung and the chest wall in what's called the pleural space. The fluid can collect for a variety of reasons, including pneumonia, cancer, or congestive heart failure. Dr. Mayer says those with this diagnosis usually undergo a procedure to remove a fluid, which allows the lungs to re-expand, allowing the patient to breathe better. COVID-19 is a respiratory illness that belongs to a large family of viruses called coronaviruses. This type of virus infects humans and animals, but this new strain has not been seen in humans before 2019. The virus seems to have originated in Wuhan, China. From what we can tell, the virus spread mainly from person to person between people who are in close contact with one another, or within about 6 feet. Like other viruses, COVID-19 spreads through droplets released when an infected person coughs, sneezes, or talks. The primary symptoms are cough, shortness of breath, and fever. If you have these symptoms, please call ahead before visiting a healthcare facility.
COVID-19 is the short name for the disease known as Novel Coronavirus Disease 2019. Coronaviruses are a large group of similar viruses. Some are known to infect humans, such as SARS-CoV and MERS-CoV. The one that causes COVID-19 is called SARS-CoV-2. All coronaviruses are named for the crown-like spikes that cover their surface, called spike or S proteins. Inside the virus, genetic material called RNA is made up of genes. Genes carry the information to make more copies of the virus. The virus can infect you if it enters your mouth, nose, or lungs. Inside your body. The S protein of the virus locks to a receptor on the surface of one of your cells. This can trigger the virus to enter the cell in a couple of ways. Carry the information to make more copies of the virus. The virus can infect you if it enters your mouth, nose, or lungs. Inside your body. The S protein of the virus locks to a receptor on the surface of one of your cells. This can trigger the virus to enter the cell in a couple of ways. Ribosome to make new copies of the virus. The new viruses travel to the surface of the cell. There, they leave to infect more cells. In the meantime, viral S proteins left on the surface protein of the virus locks to a receptor on the surface of one of your cells. This can trigger the virus to enter the cell in a couple of ways. Ribosome spread between cells. People may be infected with COVID-19 for 2 to 14 days before symptoms appear. They leave to infect more cells. Are viral S proteins left and shortness of breath. Other symptoms may include tiredness, body aches, stuffy nose, sore throat, diarrhea and vomiting, loss of appetite, and loss of smell. Most people have a mild illness and can recover at home. Some people who have the virus may not get sick at all or may show no symptoms. But if you have trouble breathing or any other symptoms that are severe, call your doctor or the emergency room. They will tell you what to do. For most people who have the virus, the risk for serious illness is thought to be low. People 65 years and older may have a higher risk for serious illness. And people of any age may be at high risk if they have underlying conditions, such as chronic lung disease or asthma, serious heart conditions, diabetes, severe obesity, chronic kidney disease, and liver disease. High-risk groups also include people with a weakened immune system, including those on certain medications, such as corticosteroids, people in cancer treatment, and those with HIV or AIDS. Even if you aren't in a high-risk group, it's important to practice social distancing, which means keeping at least 2 meters or 6 feet between you and other people. This helps prevent infections and serious illness in others as well as yourself.
Did you learn something from the discussion? To check your understanding, prepare again your paper and pen and let's answer what's more, what I have learned, and what can I do.
Multiple choice. Copy the letter that corresponds to the word or phrase that best answers the question or complete the sentence. Number 1. A rich blood from the lungs returns to which chamber of the heart? A. Right atrium, B. Right ventricle, C. Left atrium, D. Left ventricle. Number 2. Which statement is true of arteries? A. Arteries move blood away from the heart, B. Arteries carry oxygen per blood, C. Arteries move blood towards the heart, D. Arteries connect to the atria of the heart. 3. Vocal cords are made of blank. A. Elastic ligaments, B. Cartilage, C. Muscles, D. Fibers. Number 4. Blood platelets are formed in the blank. A. Spleen, B. Thymus, C. Lymph node, D. Bone marrow. 5. The heart is supplied with blood via the blank. A. Coronary artery, B. Aorta, C. Pulmonary artery, D. Systemic artery. Number 6. Which of the following leads to complete wellness and healthy lifestyle? A. Drinking alcoholic beverages, B. Smoking, sleeping late, eating oily foods, C. Skipping meals, balanced diet, regular exercise, D. Eating the right kind of foods, regular exercise, regular sleeping hours. 7. Which of the following lifestyle can affect a person's risk for developing a respiratory and circulatory disease? A. Exercise, B. Balanced diet, C. Healthy eating habits. D. Smoking and unhealthy eating, vices, and stressful environment. Number 8. How does cigarette smoking harm every organ in the body, specifically in the circulatory system? A. The circulatory system will function well. B. There is no effect in the circulatory system. C. The circulatory system will change in color. D. It can increase heart rate and blood pressure, coronary heart disease, and vascular disease. Number 9. What might happen if a person continues with a negative lifestyle? A. It has no effect on person's system. B. The person's system function well. C. No risk in the person's respiratory and circulatory system. D. The person will suffer respiratory and circulatory diseases. Number 10. Benedict is a grade 9 student. His father is a smoker and always drinks alcoholic beverages. He knows the negative effect of smoking. What should Benedict do to save the health of his father? A. Go to the police station. B. Leave him alone. C. Nothing, because his father will get angry with him if he will interfere those acts. Letter D. Explain to him the negative effects of smoking to the respiratory and circulatory system and follow healthy lifestyle. In your own understanding, answer the following briefly. Number 1. Pneumonia, a common respiratory ailment, causes buildup of liquid in air sacs of the lungs. Describe how pneumonia can affect gas exchange. Explain how this might affect the entire functioning of the body. Number 2. Both husband and wife smoke. How does this affect the lungs of the smokers and their children who are non-smokers? Number 3. How is cigarette smoking affects functioning of the respiratory and circulatory system? Number 4. Why is smoking dangerous to our health? And last, number 5. How will you maintain your respiratory and circulatory organs healthy and fit? In What Can I Do portion, please follow the directions by completing the crossword by filling in a word that fits each clue. So there are 10 items.
To sum up your understanding in the second module, please answer the 15-item test assessment. Good luck!
Multiple choice. Read the questions carefully and choose the letter of the best answer. Write your answer in your answer sheets. Number 1. What happens to the diaphragm when a person breathes in or inhales? A. The diaphragm carries blood throughout the body. B. The diaphragm prevents the blood from flowing back. C. The diaphragm contracts, allowing more air in the chest cavity. D. The diaphragm is the empty tube that serves as passageway of air into the lungs. Number 2. How does the heart work? A. The heart carries the oxygenated blood. B. The heart carries the materials throughout the body. C. The heart controls the movement of blood into the heart chambers and out to the aorta and the pulmonary artery. D. The heart propels the blood, which carries all the vital materials and removes the waste products that we do not need. Number 3. How do the heart and the lungs work together? A. Air first enters your lung and then into the left part of your heart. It is then pumped by your heart into the bloodstream all the way through your body. Once it reaches the cells, oxygen processes the nutrients to release energy. B. The lungs act as a double pump which propels blood to all parts of the body, while the heart filters blood and oxygen to be distributed to all parts of the body. C. Air first enters your lungs and then into the left part of your heart. It is then pumped by your heart into the bloodstream all the way through your body. Once it reaches the cells, carbon dioxide processes the nutrients to release energy. D. Lungs act as a valve that prevents the flow of the blood backward, while the heart is a hollow muscular organ that is the main storage of the oxygen in the body. 4. What takes place when you inhale and exhale? A. There is now more space and less air pressure inside the lungs. B. The air pushes in from the outside where there is higher pressure. C. The air we breathe goes through the nose, nasal passages, and then through the trachea. D. Gas exchange happens when we inhale and exhale. We take in oxygen and gives off carbon dioxide. Number 5. Why is oxygen important to your body? A. Oxygen is important because it emits carbon dioxide. B. Oxygen is important because it delivers nutrients and other substances that needed by the body. C. Oxygen is important to our body because it is one of the substances needed by the cells in order to make energy. D. Oxygen is important because it propels the blood, which carries all the vital materials and removes the waste products that we do not need. Number 6. How will you explain the pathway of oxygen in the breathing system? A. From the nose and mouth, oxygen travels to the bronchi, trachea, bronchioles, and then to the alveoli. B. From the nose and mouth, oxygen travels to the bronchioles, bronchi, trachea, and then into the alveoli. C. From the nose and mouth, oxygen travels to the alveoli, bronchioles, bronchi, and then into the alveoli. D. From the nose and mouth, oxygen travels to the trachea, bronchi, bronchioles, and then into the alveoli. Number 7. What will happen if oxygen is not transported by the blood to the different parts of the body? A. The cells in our body will be able to process less nutrients to provide energy for the body. B. The cells in our body will be able to process more nutrients to provide energy for the body. C. The cells in our body will be able to process the nutrients to provide energy for the body and they will not die. D. The cells in our body will not be able to process the nutrients to provide energy for the body and they will die. Number 8. Why the human heart is called a double pump? A. The heart pumps allowing more air into the chest cavity. B. The heart pumps at the left side to circulate the blood throughout the body. C. The heart pumps on one side, the right, to circulate the blood throughout the body. D. The heart pumps on every side, the left and the right, to circulate the blood throughout the body. Number 9. How does blood vessel work? A. Pumps blood throughout the body. B. Carries the oxygenated blood to the heart. C. Carries materials throughout the body. D. Carries the blood throughout the body. Number 10. Why do gym instructors or PE teachers instruct you to breathe deeply when exercising? A. Since exercise leads to hard breathing and sweating, deep breathing is needed to allow enough oxygen to get in the lungs and get rid of waste in the form of carbon dioxide. B. Since exercise leads to hard breathing and sweating is not needed to allow enough oxygen to get in the lungs and get rid of waste in the form of oxygen. C. Oxygen is not needed during exercising because our body has enough supply of it. D. None of the above. Number 11. What do you call the muscular motor of your circulatory system? A. Heart. B. Lungs. C. Kidney. D. Arteries. Number 12. What blood vessel surrounds the alveoli? A. Arteries. B. Capillaries. C. Veins. D. Valve. Number 13. Refers to how the cells of the body use oxygen to create energy and how they exhale carbon dioxide that is a waste product of this process. A. Breathing. B. Respiration. C. Circulation. D. Ventilation. Number 14. What type of damage can coronavirus cause in the lungs? A. COVID-19, the disease caused by the new coronavirus, can cause lung complications such as pneumonia and in the most severe cases, ARDS or acute respiratory distress syndrome. B. COVID-19, the disease caused by the new coronavirus, can cause lung complications such as emphysema and in the most severe cases, ARDS or acute respiratory distress syndrome. C. COVID-19, the disease caused by the new coronavirus, can cause lung complications such as pleural effusion and in the most severe cases or ARDS. D. COVID-19, the disease caused by the new coronavirus, can cause lung complications such as asthma and in the most severe cases ARDS or acute respiratory distress syndrome. Last, number 15. If your complaint involves lungs or any part of the circulatory system, where will you go? A. Cardiologist. B. Pulmonologist. C. General surgeon. D. OB/GYN.
For further knowledge and application of our lesson, prepare your art materials for you will be making a poster about information dissemination on how to take good care of your respiratory and circulatory systems. Please refer on the rubrics flashed on the screen.
In a piece of one long band paper, create a poster that disseminates the information on how to take care of the respiratory and circulatory system. You are graded with the following rubrics.
Congratulations, grade 9 students! You have finished the second module. Hoping that you've learned something. This has been Teacher Rose, reminding you all to be safe and don't forget to take good care of your body because health is wealth.